Hello, I am Dr.Praveen retina consultant and the Eye Foundation, Kochi. The main topic is diabetes and diabetic related eye diseases. Diabetes is the most common systemic disease. Then the main awareness is lacking, especially in India as well as the world. Diabetes is the most talked about disease across the world, not only in India. Even though it is the most talked about disease, the awareness for the same is lacking. In 2013, according to the world data, the statistics in India is quite high. The prevalence of disease in India is very, very high. And not only the prevalence, the population, since the population in India is very high, the number of patients with disease having diabetes is very high. Now, what is diabetic retinopathy? Diabetic retinopathy is a condition where the blood vessels in the eye, especially in the retina, are affected. Now, what is retina? Retina is the most posterior layer of the eye, which is the neural tissue which conducts the image from the eye to the brain. And this is the area where diabetic retinopathy affects. Coming to the second most common point what a patient asks is, what are the symptoms? As a patient perspective, what do they see? So they may have a completely normal vision, or some patient may have certain floating particles or drop in vision. However, most of the patients have a normal vision. Now, what causes diabetic retinopathy? The one and major cause is only blood sugar. Only high blood sugar is the one which causes diabetic retinopathy, and this also over period of time it can cause diabetic retinopathy. Along with that, a high blood pressure and cholesterol adds on to the problem. Now, how do you diagnose? How can we say that this patient has diabetic retinopathy? So the patient should come to a doctor, should have an eye evaluation. Once they come to us, we put drops, dilate the patient and look into the eye to see the retina and the blood flow. Once we see the patient, we subject this patient for certain investigation, which can be either a fundus fluorescein angiogram, where we inject the dye into the vessel, and the same dye is seen in the eye flowing in the blood vessel, and to see what are the abnormality in the blood vessel. How do we diagnose diabetic retinopathy? To diagnose, the patient has to see their doctor, especially retina specialist. They should come to eye doctor, where we put drops, dilate the eye, and we see into the eye to see any changes are there. If any obvious changes are there, we label them as diabetic retinopathy, and the treatment is advised to the patient. In certain case, we do investigation like fundus fluorescein angiogram, where we inject the dye into the vein of the patient, and we see the blood flow and the dye flow in the eye. The second test what commonly done is optical coherence tomography, where a light rays go into the eye and we see the retina and the damages in the retina. Now, how do we treat a diabetic retinopathy? In the early stages, there are no treatment for diabetic retinopathy. So, best thing for all the patient is to have a very good control of systemic factors, especially the sugar. Once it goes to a stage where we have to treat, that's the time when we do something called lasers. Lasers are basically to stop the leaking blood vessels or the other flow mechanisms. Second thing what we do is, in certain cases or advanced cases, we go ahead with intravitreal injection, where we give the medicine directly into the eye. And the last thing is surgery. What we do is called vitrectomy. Now, you may ask, what are the preventive measures for all retinopathy? So the only way to prevent diabetic retinopathy from developing or from progression is to have a very good diet, very good control of blood sugar, which can be done with regular moderate exercise throughout the year. You should not skip a single day, and along with that, control of other factors like blood pressure, your cholesterol. Just the last to say a takeaway message for all of you, that diabetes is a slow disease. It is potentially blinding disease. So be mind that once you are diagnosed with diabetes, have an annual eye checkup. This is very, very important, so that all of you are examined annually, and in early stages we can pick up and we can treat so that you don't lose vision. Other than this, most important, as I told you, is to control your blood sugar, have a regular checkup both with a eye doctor as well as a physician, and have a good control of systemic factors.